when somebody's having stress incontinence, what is the basic treatment that you're going to do?
So the first thing we'll talk about is Kegels. Are they doing them, and do they know how?
What is a Kegel, and how do you do it?
So a Kegel exercise is a very good question. A Kegel exercise is, I had one of my patients called it her pucker muscle, but it's when you start to pee, you can contract your pelvic floor muscle and cut your stream off. Now that would be to find the muscle, but not necessarily to do it. But that's the muscle you would exercise to strengthen your pelvic floor muscles. It is a skeletal muscle, so you can control it.
So how do you know how to do that? How to find it? How to, do you have to start while you're urinating? You have to start stopping the flow, and then you realize what kind of pressure you're trying to put down?
Exactly, but I don't want people to move all around. I just want them to raise their pelvic floor. So we will talk about that. I have instruction sheets. And then that's one of the classic ways I teach patients is when you start to pee, try to cut your stream off. That's the muscle you're going to exercise. We actually have pelvic floor physical therapy, which is very underutilized. And they, for patients that can't figure it out, don't know how to control it,
sure,
they can train those patients.
Can you tell if somebody's doing Kegel properly?
Yes, you can on exam.
Okay, and so if you're examining the area around the urethra, you can see if the muscles tighten up or squeeze down on the urethra to keep the incontinence.
Correct.
Now, if I'm running, and if I run and I was a female, and that would cause some incontinence, how can you run and do Kegel at the same time?
You can't do that. I mean, that would be hard. You can try to contract it a little bit, but you want to do the exercises ahead of time so you build up the muscle just as if you were building up your bicep muscle so that it's stronger for when you are running.
So you're increasing tone that stays there for all the time,
Correct.
Not just when you're wanting to use it.
Correct.
Is it pretty easy to do?
Yes, Kegel exercises are very easy to do.
Do you have videos on people? Do you have certain positions? I was actually cheating and looking on the video of how to do a Kegel, and there were different body positions that people would be.
Yeah, so you can do lots of different ways of Kegels. We actually teach people most of the time 2 different kinds. We call them the flicker, so when you just squeeze and release them. And then you have the squeeze and hold. And so those are more your endurance muscle fibers that you're working on for maybe when you're running long distance. For patients that really can't do it, that's where we will do the pelvic floor physical therapy. And those are expert subspecialty physical therapists. And they can even do biofeedback and muscle retraining to teach that if a patient is sort of struggling to get it down on their own.
I think that's phenomenal. Is it effective?
Yes.
Does it work?
It does work, and in fact, it's way underutilized. I had a patient the other day who had been through a whole lot of treatments, a lot of tests, and when we finally got her to physical therapy, that is what cured her.
Is it easy for people to tighten down, squeeze the pelvic muscle? As I think about it, I just squeeze the whole area, but can they isolate the muscles that are used
the pelvic floor muscles are sort of a continuous pelvic floor musculature, so you can isolate just that set of muscles to exercise. So yes, and so that's one of the things that we teach.
You also weight loss. Have you got a special way to encourage people to lose weight? Eat less, be more active?
Yeah,
that's basically what it is.
Yeah, simple formula. Expend more calories than you take in.
Yeah,
and we talk about making good, healthy dietary choices.